Hello everyone, I'm going to be joined by Dr. Gallus in a couple minutes, and we will be talking about recovery after tummy tuck, which is one of our very favorite surgeries, both of us. We have similar practices, which is kind of funny because she is in San Diego and I am in Cleveland, Ohio. As soon as she pops on here, there she is. All right, should be coming on in a second.
Hey.
Hello. How are you?
I'm good.
Yeah.
Hanging in there. How
Yeah,
about you?
it's been a month. We've had 3 people out for 3 weeks now. 2 with COVID, 1 on quarantine.
And then, were they vaccinated, not vaccinated?
Um,
No, can you not ask?
Yeah, I mean, I'm not requiring it. I don't think they were. But obviously, my patient care coordinator lost her dad last week from COVID. One of my receptionists / MA lost her dad earlier in the year from COVID, and my cousin died 2 days ago from COVID. She was 28.
Your cousin?
Yeah. And otherwise healthy. I don't think she was vaccinated. I don't know for sure. But yeah, healthy 28-year-old.
That's terrible. Yeah, there's a little bump in San Diego, but I saw the San Diego County put out a thing, like there's, let's say 510 people hospitalized with COVID, and 500 of them are unvaccinated and 10 of them are vaccinated. And then it's just, we're over 70% vaccinated in San Diego.
Wow.
Yeah.
That's good.
It's not, we're doing okay, but it is really scary. And it's a bummer because I feel like we were at that point where everyone was like, I'm going to Vegas, I'm traveling. And I went to Hawaii. People are trying to travel. I know a lot of people who went to Europe, and I was like, oh. So you're having to rethink all of that just when you got all excited about maybe going somewhere again.
True. Well, and the dad who just died, my patient care coordinator said he was vaccinated. He's in Florida. My cousin's also in Florida. I know numbers are higher there. Cleveland's been okay, but Ohio's starting to come up.
Oh, okay. Yeah, Florida is pretty bad. My mom just left to go to Florida last night. I feel like might be invincible. So, hopefully. And she's vaccinated. Good. She's pretty sturdy. It's like the 3rd or 4th time she's gone during this whole shenanigan. So.
Oh my gosh. I know we're scheduled to go in October, and I'm just going to wait and see. We'll see what's happening.
To Florida?
Yeah.
Mm-hmm.
Yeah, I was like, we got to plan some trip so we have something to look forward to.
Yeah,
and if we
absolutely.
Cancel, then we'll cancel.
Yeah, I think that's fair. Are you going to go to plastic surgery in the meeting in Atlanta or no?
I am registered, yeah. Planning on going, but again, we'll kind of see how things go.
Mm-hmm.
How about you?
Yeah, I'm planning to go.
Yeah.
I already have a bunch of commitments and whatnot there.
Yeah, so I'm on a panel, and
mm-hmm.
Plus I would like to meet you in person.
Yeah, I know. What panel are you on?
It's about work-life balance, which will be extra hilarious as the kids come buzzing through here in their Captain America and astronaut costumes in a couple minutes. So, balance.
What's no balance. I know.
What that is. It's fine.
Cool. Very nice. Yeah. I think I'm on my dog is sleeping in the background.
Aww.
So, speaking of work-life balance, this morning I got up early because I was getting ready for a case. I was doing facial surgery, and my dog was sick, and has been on and off sick for a few days, but really looked bad. And then my youngest, it was her first day of school, so I was bringing her to school. And so there was just a lot going on. And I'm like, I have to get my day going. So figured out a plan to get the dog to the vet and then drop my daughter off at school, and then went to the OR. So
yeah, we've all had it. I once had the OR bump up a case, and I didn't realize they had, and I got a call from them, and I was dropping my son off at his first day of kindergarten. They were like, oh, you're scheduled to start. So I called my patient, and I was like, hey, I am dropping Wyatt off at kindergarten. I'll be there. She's also a mom. She was totally fine with it.
Yeah.
Just one of those things.
I know. So I was like, yeah, we'll get it all. It was a little hectic, and then we figured it out. And luckily, my dog did not need surgery. So
good.
Was fine.
He's
I guess.
resting.
Like maybe she could stop eating garbage off the street and we
That would probably help. Yeah. Oh well.
She loves it though. I don't know why she'll see like a rotten banana and think that's like awesome sauce. I'm like, no, don't.
Dogs are just weird that way.
Ugh. So, okay, yeah, and I'm supposed to be talking on a facial plastic surgery panel, so that we should all be interested in that.
I will be there. I'll be like, question.
Yeah, I have lots of questions.
That'll be fun. Well, I haven't even been to plastic surgery at a meeting since my chief year in residency, which was
my goodness.
years ago. Yeah, well, I've been, I was having three kids, so I haven't traveled. So I'm really excited to go now as an attending and knowing people and like being on a panel. It's really fun. I'm on committee.
It's going to be
now.
awesome. It's going to be so good. Yeah, there's so many things to do and see people in real life. And hi, everybody that's joining. And yes, garbage and raccoon poop are huge dog treats for some reason.
Yeah, well, they are.
She has 4 dogs, so she knows.
Oh my
And
God.
she has one dog that's like on a revolving door to the vet because he's so old and frail.
Poor thing.
It is. And then, so anyway, so let's talk. We're talking tummy tuck.
Tummy
recovery,
tuck,
right?
yeah. We were going to talk about recovery after tummy tuck and got, sidetracked by COVID and dogs eating garbage, as we do. If you guys have any questions about tummy tuck or recovery after tummy tuck, or if my kid's screaming is too loud and you need me to shut the door, just throw it in the comments. We're keeping an eye on those. Yeah. So it's interesting. When I was a resident, all of our tummy tuck patients stayed overnight.
Mm-hmm. Same. The hospital setting thing, I believe. I don't know.
Yeah, I don't know. It was so funny. Like, as a resident, our breast reduction stayed overnight. Our tummy tuck stayed like everyone stayed overnight. And now I send everyone home. Although it's kind of different patient populations too. My nanny's telling me to put the kids to bed. Bridget, that's never going to happen while I'm awake.
Right. Yeah. So, yeah, I agree. It was a lot of breast reduction patients stayed because it was not a cost that they were going to incur, and it was just, something that they did. But yeah. Currently in the quote real world, like you go home and it's better for you to get up and move around for starters, I think.
Yeah. And your own bed is more comfortable and and there aren't a bunch of sick, contagious people around you, which is great.
Yeah, that also helps. And not some nurse coming and waking you up every 20 minutes to take your vital signs.
That was the worst after having kids. It was like, can I please sleep? Please?
I know.
Yeah, so I actually admitted patients for the first year or two as an attending, and then they would call me. They'd be like, it's 8 o'clock. Can I just go home?
You're like, okay.
Yep. So it's pretty much outpatient surgery for tummy tuck, which I think is one of those operations that people think is going to be so much worse than it is most of the time.
Yeah, I think so. I think the first 1 to 2 weeks can be rough, and I think it's variable. I think some patients are I have some patients, I have them come in the first day after surgery. Do you?
I don't see them for a week. I call them that night. So
yeah, I call them that night.
They're worried about anything, but I usually wait a full week.
I drag them in the next day because I want them to come in and walk. And so some people are great and hobble in, no problem. Other people request a wheelchair, and we bring them up with a wheelchair just to make sure everything's okay. Drains are working. You don't use drains, though, right? So no.
I do.
Sometimes
I do BMI over 30.
Oh, okay.
And I do a lot of BMI over 30 as well.
Right.
Like I've done honestly even some BMI over 40 with really nice results. So I'm like straddling that weird dichotomy of I'll do drainless tummy tucks, but I'll also do high BMI.
Okay.
Which is actually pretty fun and something worth talking about. But yeah, so when I can do drainless, I love it. Patients are more comfortable. If I do need a drain, I only use one, and then I end up leaving it in usually for 2 weeks. But that's usually my higher BMI patients. And it's a pain. They don't love it.
Nobody likes the drains. They're brutal.
No.
Yeah. I had a drain, actually. I had a scar revision, my C-section scar from 3 C-sections, and I had it revised. And they didn't put a drain in because it was a small area, but I am a doctor, which makes me high risk for things. And so I got a fluid collection and I tried to drain it and didn't. So eventually I had to have IR, interventional radiology, put in a drain after the fact and drag that around for a couple weeks. And I was like, these really suck. Like, they're terrible. Like, there's nowhere to hide them. They're just annoying.
Yeah, they like tug and pull and they're uncomfortable. I know. Do you let people shower with the drain in? I do. Okay.
Yeah, I do too. Yeah, there's a lot of rules that were in place, I think, early on, either in residency or you did things. I think in residency, I think the attendings are just super conservative because that's what they can control. And then you get out into the real world and you're like, no, you can totally shower. It's fine.
Yeah, it's fine. It will be okay. You just have to hold the drain on something, a lanyard around your neck. By the way, it works really, really well.
Yeah. So, okay. So speaking of recovery after tummy tuck, you go home that day. Do you send people home with little portable squeezers like SCDs?
I don't. I tell them to get up and walk around. And if they're laying in bed for a while, I tell them to point and flex their toes 10 times, like every hour. Okay. In my whole practice so far, I've had one DVT/PE in a massive skin removal patient. I do assess Caprini score in everybody, which assesses your risk of blood clots. Even with that, though, we know the risk is increased, I think, for a Caprini score of 4 or higher. I don't anticoagulate until 7, which is kind of what I was taught. It's not necessarily great based data. You know, there's not super strong data behind that. This is something plastic surgeons talk a lot about. Oh, DVT and PE. Thank you, Erin, for making me translate. So DVT is deep vein thrombosis. PE is pulmonary embolism. So when you get a clot in the deeper veins of your legs, a clot is a thrombosis, it can break off and travel to your lungs, which is called a pulmonary embolus, which can damage lung tissue or even be fatal in rare cases. And having a blood clot is higher risk anytime you have surgery because your blood is in clotting mode. And often you'll have the additional factor of being kind of immobile, which, you know, after knee surgery, you get put on anticoagulants because you're not up and walking around. With most of the operations we do as plastic surgeons, people are up and moving, but kind of to varying degrees. And also with tummy tuck, if you're tightening the muscles, there's theories that it does decrease the venous return from your legs and maybe make you a little more prone to clotting.
Yeah, again, not great literature to support that. But certainly if you've had a risk factor from something else, like you've had a clot before in your legs documented for whatever reason, or you have a history of easy bruising, bleeding, those are like kind of things we screen for. If you've had a history of a lot of miscarriages, those are
history
things
of cancer, non-skin cancer, but any type of cancer. Being on hormone replacement, oral contraceptives increases your risk a little bit, and higher BMI and higher age do as well.
Right, and length of surgery, but only it's over 45 minutes, so pretty much everyone gets points for that. So it is a point system, and that has been delineated, and then you get however many points you are, and then that tells us a little bit about whether we should prescribe you a blood thinning medication for after surgery. Yeah. Most people, it's just having little squeezers on their legs when they're in surgery to help your circulation for your legs. Keeping their body temperature normal and not too cold, and then early moving around. So early walking is helpful. Those things are all known entities. And so I do send people home on, they're called Circulates, spelled CIRCUL8, because it's like a band or something. I don't know. It's a funny name.
So, or like a license plate.
Yes, it does look like a license plate. So, so Circulates, and they are battery powered, and they go home on those and they stay on for a handful of days. So if for some reason they're not walking around, I know at least things are squeezing. But I do have them come in the next day. I most often leave drains, and then they come out the next week. But I do tell patients, right, when you get home, I tell patients to be really well hydrated before surgery. So push fluids, push water a couple days before surgery. And then when you go home, I mean, a lot of questions I get are related to how do I sleep? You can put some pillows under your knees, propped up on some pillows under your back so that you're kind of in a V, because that'll be more comfortable, certainly. And I do put people in a garment, so.
I do as well. I will use compression foam as well. And I've been doing binder over the garment.
Oh, wow.
Yeah. Well, I've had some seromas, which is annoying. That's probably one of the biggest annoyances of tummy tuck.
Yeah.
And that has seemed to help. I do a lot of internal plication sutures. Probably do more. Everybody could always do more. But yeah, I do like the Tapa foam and the garment. The binder just stays on over for 1 week, and then they drop back to one of them.
Okay. Yeah. Yeah. So fluid collections are probably the most common complication of tummy tuck, and maybe like a little bit of a wound breakdown or healing issues at the incision is probably the other.
Yeah, we get like a little rim. I mean, you can have big areas of wound healing problems, and we've all unfortunately seen that as well. But yeah, the seromas are kind of the big nuisance because then you have to get them drained a lot. A lot of it, I think, is just patients feel deceptively well after. I had a tummy tuck patient text me on Saturday. She's like, so if I were developing a seroma, it would kind of feel sloshy, right? She was a nurse. She'd gone back to work. I said, were you doing a lot of bending and twisting? She's like, yeah, the entire shift. I'm like, okay, well, we'll drain it. We'll do your binder on over your garment again. Because when you're moving like that, your skin just can't stick back down.
Right. Which is probably how I got my seroma, because you never slow down. Doctors and nurses are the worst patients, hands down.
But seromas at least are fairly easy to deal with. They're a nuisance. You drain them several times, get some good compression, and then they seal up.
Yes, and then they go away. So any other tips? Do you have patients take Arnica or Bromelain?
We carry the Silogen Arnica Bromelain supplements. I like the Bromelain. I know there's good clinical studies showing improvement in bruising and swelling. I don't believe in Arnica because it's homeopathy, and I don't believe in homeopathy. Which, I don't know. Do you know much about homeopathy? I did like an entire podcast episode on this one, so I get weird about it. But homeopathy is based on this theory that the more you dilute something, the more potent it is. So the dilutions are like 1 in a million, to the point where there's like not a single molecule of the active substance. So most Arnica is just a sugar pill. Same thing with like the teething tablets. There's not anything actually in them. So scientifically, it doesn't make a lot of sense to me, but it comes with the Bromelain, and I like the Bromelain. So there we go. How about you?
Yeah, Bromelain.
Oh, no, Bromelain is not homeopathy, I don't think, Erin. It's an actual supplement like vitamin C or zinc. The homeopathic preparations are serially diluted to like 1 part in 1 million, whereas Bromelain's just like taking a vitamin C supplement.
Right. Or eating a ton of pineapple.
Yes, which you can also do, and if that burns your tongue, it's not the vitamin C. There's an enzyme in the pineapple, and you can denature the enzyme by soaking it in salt water and then rinsing it off.
Oh, I didn't know that.
I mean, if you needed more random facts from
me. More random facts. Well, here's a random fact. Did you ever read that book, Educated? The one...
Tara Westover?
Yes.
Oh my gosh.
And her parents or her mom went from being a midwife to offering homeopathic medicines or essential oils or something, and had that whole, and still exists, and you can buy them. So it's 1 part per million of lavender oil or something.
I could sell that. I mean, I have tap water. I can. Yeah. Homeopathy is really fascinating because there have been several like randomized trials on whether Arnica works, and I think most people don't really understand what homeopathy is. And I don't remember why I ever looked it up, but I read it and I was like, this is not science in any meaningful way. It's like some random theory from this German guy in the 1800s, kind of like chiropractic. Don't get me on that one either. But yeah, I have lots of weird esoteric knowledge. Well, chiropractic is the idea that you can cure anything by manipulating the spine. And the guy who created it claimed to have cured deafness by doing a spinal manipulation. I think like more mainstream chiropractors just do muscle, musculoskeletal manipulations, and that's cool. But the real hardcore guys will say like, well, I can cure diabetes by adjusting your neck. It's fascinating. I agree. Yeah, but I do like to have my back cracked because it feels good. Yeah,
that feels amazing. All right, so Bromelain you're a fan of.
I am.
Do you have them take any other supplements like zinc or vitamin C, or only if they want to?
The Silogen Scar Gel company makes this very convenient Arnica Bromelain vitamin C zinc, and we just include it with all the surgery packages. So they take it twice a day starting 2 days before surgery. Vitamin C and zinc have been shown to help with wound healing if you're deficient at all, and you can't overdose in the short term on those. So
Right.
I just figure it does cover bases nicely. And
Cool. I
yeah,
hope Erin's writing this down. So
it's called
we give,
Silagen, Silagen. It's from New Medical.
I know they're scar cream. So
Yeah.
so I know the company. I just didn't realize they made because we just give people a list, and then by the time you go to Sprouts or Whole Foods, you have like 18 things.
Yeah, so we just give them that, and then we actually give them the scar gel at their 1 month post-op. And it's just included in the surgery package. They don't have to worry about it. They don't have to buy it. Same with their garments. They get to,
Nice.
keep it simple.
What kind of, so here's another topic, Erin, since she's interacting. Garments. What brand of garments? So I feel like she just recently had liposuction, and she probably she's gone through like 800 garments in terms of trying, like we've trialed them all, and we have trialed with our patients. We'll find one we really like, and then somebody will point out, oh, it doesn't zip right or whatever, it's the torsos are too long, and then we'll switch again. Or because of the last 2 years, it's been so hard for shipping and distribution that we'll have a company that we like working with. Their garments are great, but then we're like, where's the stuff we ordered? Yeah. So we've used Marina, Isabella, ClearPoint Medical.
That's who I use now.
Okay, that's who we mostly use now.
Yeah, they fit most people pretty well. There are always people who it doesn't fit right, and I'm like, go to Kohl's, get some Spanx. It's better than nothing. Yeah, those hook and eye closures in the groin area are a little tricky. I wore a ClearPoint Medical. Well, when I had lipo, I wore an Isabella, and then I got a ClearPoint Medical for my office. And, like, it's not bad. It's pretty comfy.
Yeah. So, yeah, there are so many versions of garments. So, yeah, I think we used Isabella, and then we had shipping issues and switched to ClearPoint, which has been mostly okay.
And the funny thing is, like, I've always called it a garment, but I have so many patients who call it a faja.
Oh, yeah. So faja, I think, yes, they call it a faja or a faja board. So that board that you can put in.
There's like a board that goes in. This is a whole thing that I have learned about from patients.
Yeah, whole niche of like garments. I know. And then people are like, you should just design one that has, I'm like, no.
There are people better skilled than me doing this. Yeah.
Right.
I mean, it's never going to be perfect. Sometimes people just end up in a binder because they're very short-waisted or the garment's a pain in the butt.
Yeah. Yes.
I know there are many surgeons who don't use garments at all, and that still boggles my mind. I just feel like everything would be sliding around and uncomfortable.
I feel like that would be, frightening. But yes, people sometimes choose not to wear them because of all the things we just described. It's a hassle. Who knows? It's funny, when I did, I've done a lot of burn surgery in my day. I did some as a general surgery resident and some as a plastic surgery resident. And compression garments are useful for patients who've had burns for flattening the scar. Yeah. And UCSD actually had, and I don't know if this is still true, they had seamstresses that would custom make the burn patients garments. And there was like a room with sewing machines, and they would come and get fitted, and it was unique in that way. It was one of the few places that did that, but it was super effective. It's just, manpower and expensive and all those things, but
pretty amazing though.
Could you imagine though, if you're like, oh yeah, so after your tummy tuck, you're just going to go meet the seamstresses and they will custom make a garment for you.
They will make it bespoke, which is my favorite word. It sounds so fancy. Maybe I should hook up with a tailor. Yeah, and just be like, oh, you alter garments.
Yeah, we should create bespoke garments.
There we go. Oh my gosh, it would be so ridiculously expensive. And by the time they got shipped to you, you would be all healed. Which reminds me of another thing. Do you recommend lymphatic massage? Because that's another thing people read about and they wonder, like, how important is this?
So early on, I didn't really recommend it. I sort of moved in that direction because I do think it helps. It's funny, I was on Clubhouse. I don't know if that's still a thing. Are you on that?
I have an account. I never log on.
I haven't been on there. So I was on a Clubhouse panel about plastic surgery recovery or lipo. I can't even remember. And I remember because they had one of the local massage therapist. She's local to San Diego. And I was like, oh, cool.
Mm-hmm.
Kathleen's on this call. And she does manual lymphatic drainage. And I remember her also from when I did a lot of breast reconstruction at the Navy hospital. We would refer patients to her for that too, after having node biopsies and had arm swelling. So anyway, so I'm excited to see her on there. And then I also see Karen Horton, who's another friend of mine from San Francisco. And the panel moderator asked a question about lymphatic drainage. And Karen's like, I don't know anything about it except what my massage therapist told me, which was that it's nonsense. And I was like, do you see who else is on the call?
There's a massage.
She doesn't care. So then Kathleen was talking about it, and I do think it's helpful. And I have the patient feedback is, I recommend it. I don't require it, obviously. And the ones that go really, really feel like it makes a difference. And it makes sense. It's sort of like manual compression, right? I mean,
No, I love it. I wish I could find a massage therapist in Cleveland who offers lymphatic massage, because my patients have looked too and haven't had any success. I have a friend who's a massage therapist. I'm like, get certified in lymphatics.
You don't want just somebody who's gonna,
Yeah.
They need to know
I
what
have
they're
told
doing.
patients, though, if they're really concerned about swelling, I'm like, you know what? Look up a YouTube video. It's not something you're going to hurt yourself with. It's very light massage.
Right.
And you just kind of need to be going in the direction of the lymphatics. So if anyone knows a good lymphatic massage therapist in Cleveland, give me a shout out.
Yeah. I know. That would be helpful. Yeah, we have more than one. So
You're in the big city. I'm in the Midwest.
Yes, that's right. I know. We can probably get somebody who would do it for your dog, to be honest.
This is true. Yeah, I bet you could.
Okay, so lymphatic massage. We talked about supplements, compression garments, staying hydrated, sleeping properly.
Yeah.
What else do you...
activity restrictions. I feel like I am always reining my patients in. I had one lovely lady, Saroma, and I was like, what have you been doing this week? She's like, well, let's see. On Tuesday, I delivered a bunch of Avon. I'm like, you had surgery on Monday. Why are you delivering Avon?
No.
Go home and sleep.
No.
Yeah,
so taking it easy. Yeah.
Yes, I've been telling people, stay home, take naps, have someone watch your children. Don't be doing a lot. And then once the drain is out, or week 1 to 2, then you can start doing some short walks, but not 10-mile hikes.
Right, because usually sometimes at the 2-week mark I get. So Peloton, okay? No. Or actually, Erin will remember that one of my patients, she was probably 3 weeks out, and I knew she had a planned trip to Hawaii after surgery at 4 to 6 weeks, which we had talked about it in advance, and that, I promise I'm not going to do anything, I'm just going to lay by the pool. So I always, if I know someone's going out of town, I see them right before they go out of town.
Right.
So I'm like, oh, you're so excited for your trip. And she's like, yeah. So scuba diving? Oh, no. I was like, do you scuba dive? She's like, no, but I thought I'd learn. No. This is not the trip to learn.
I know.
Put it
We're
on
all
pause.
terrible. I mean, yeah.
She's like, I thought I'd ask.
At 4 weeks, I will let people get back to more activity, but still, even core exercises, hold off on that. We just repaired some muscles.
Yes, take it easy. 4 weeks. 2 weeks you can start moving around, but I tell them it's 4 to 6 weeks of protecting that diastasis repair, so bringing your core muscles together and suturing them down. And you really want to not pressure that and have that stick. So you're right. It's hard. I feel like the first 2 weeks, people are a little sore and kind of, slowed down a little bit. And then it's the next 2 weeks, so weeks 2 to 4, where you're pump your brakes, take a little time off.
Yes.
Maybe that's not the time to deep clean the house or whatever it is.
No, I know you're off. It seems like a good idea. It's not.
Right. Cool.
Yeah.
So, wow, that went fast, I think.
I know.
We talked about sick dogs. And when do your kids start school?
Let's see. My son starts 2nd grade on Monday. My daughter's kindergarten, so her first day is not till Thursday because she has to go to meet her teacher and everything.
Oh, that's super cute. Yay.
Yeah. How about yours?
So my 4th grader started today, and my 8th and my 10th grader start mañana.
It's so early.
I know. They got out. The older 2 were done by like Memorial Day. They're like, summer was so short. I'm like, oh, it's fine.
I know it's good when they're back. We are totally losing your internet connection.
Oh, okay. Well, we'll figure
give it
out.
a second, see if it comes back.
Uh-oh.
Yeah, we'll have to figure out our topic for next time. Probably 2 weeks or so. Usually.
Yeah.
We can look at calendars.
2 weeks.
Yeah, any requests for topics for next time, guys?
I guess no. Erin says they start on a Thursday. Yes, that is true because their last day of school was a Wednesday, whatever logic that is.
That's right. Yeah.
So, whatever. I've long stopped caring about when school starts and stops because it makes no sense ever.
Supplements.
Erin,
have you been checking out my podcast topics? I stopped my podcast like over 2 years ago, but yeah, supplements are a fun topic. I actually took a class in med school on food, drug, and biotech law, which was entertaining. Yeah. So interesting stuff there.
Let's talk about that. I think that'll be good.
That'll be a good topic. Cool. And whether, collagen actually helps healing or not.
That's
good things. Cool.
Yeah. All right. I'll have to do a little research probably before, but it sounds good.
Yeah. Awesome.
All right. Have a good evening.
You too. Stay healthy.
Yeah, you too. Bye.
Bye.